Hello, hello, bonjour, Connect Hearing community. Welcome to our 10th live video. I usually start my videos always chatting a little bit about how was your week, if you had a good week, if you had something fun. But today I'm most certain that this very respectful community is feeling exactly the same as we are, me, Connect Hearing. So Connect Hearing stand against any type of racism, any type of discrimination. So let's spread love, let's be respectful to each other, let's listen and create a better world. So as you know me already from the other video, you know that I would cry easily, so I will hold myself. And I want to start today apologizing for a mistake that I made on my last video. So if you haven't watched, my last video was about the 5-topic solutions for background noise. And I talk about Rogers system. So one of my mistake was, I don't know where I had my head at that moment, but the Rogers FM system, if you don't know, if you didn't watch, is an accessory that helps you hear in background noise. It's a hearing aid accessory that helps you to hear background noise. And there is two parts, a microphone transmitter and a receiver. And for some reason, I kept saying this part as a microphone, but it's actually a receiver. So the receiver is attached to a streamer or to your hearing aids, and then you would have a certain type of microphone. So I want to apologize for that. And the other thing I noticed when I was watching my other video as well, that I don't think I was clear enough, is the Rogers is not a Rogers FM system. So the Rogers system came to instead of to replace, let's say, the FM systems. And so it's just a Rogers system. So it's a digital system. It's not it doesn't use a frequency modulated. So it runs on 2.4 gigahertz. Okay. So I just want to make sure I would clarify that because I need to start sleeping again. And I just want to make sure you get the right information. But everything else was correct. So you can definitely rewatch the video. Hello. Hi, Kurt. Hi, Brandy. Hello. Hi, Reese. Hey Betty, happy Tuesday. So the reason I'm here today, and I think you probably noticed that there is a different background from all my other videos. I am in the clinic today and super excited to be here. But I will explain to you about what we're going to be going over soon here on the topics. So welcome to our 10th live video. My name is Christiane Basilio. I am an audiologist. I have been working in the field for 18 years and for the last 13 years for Connect Hearing. And we have been doing these videos every week, bringing you some information of the hearing world, hearing aids, and answering questions that you had. So you can like our page, like our video to get some notifications. And the topic for today, I will be going over some of the safety measures that we have implemented on top of our already high standards we had in the clinic. I will be going over a bit of the remote support as well. I think there is, as I'm in the clinic, I can show you really nice how it works, the remote support, so it may be easier for you to see and imagine how it's gonna work. And then I'm gonna also go over the how to wear masks with the hearing aids. I did mention that in the beginning, in one of my other videos actually, that it's gonna be tricky to wear masks despite the difficult in communication that would cause, but also how comfortable and how safe is for you to wear the mask with the hearing aid. So we go over all those topics, so stay with me until the end. So to start, I want to bring you good news. As I said, I am in one of our clinics today, and all our clinics are open, except Ontario, that will be open in about 2 weeks, and Nova Scotia in about 1 week from today. So we are in clinic and ready to help you, and I want to make sure you feel safe to come to our clinics. So that's why I want to share with you these safe measures that we implemented. I want to start with one of the major changes that you will notice is we are going to be working on appointment only during this crisis. I know if you've been our patient for a long time, you probably were used to just, anytime you had a problem with hearing aids, you maybe would just come over and get batteries and get them cleaned. And that service, of course, is still going to be included for you. But we just expect now that you would give us a call on your local clinic, and they will guide you what would be the best time for you to come in, and also to see if you need an appointment face-to-face, or if you can use our curbside pickup contactless program. So we have a really good pickup program in place, so that's an option as well. But now that the clinics are open, if you need to see us, that's going to be an option as well. But just appointments only, no walk-ins for now, and I don't know for how long. Sorry, it's something that we don't know. To start, and for you to feel safe when coming in here, what you're going to be seeing is definitely all our staff will be wearing masks when you come in. We do encourage you to come with your own mask, but if you don't have one and you're going to be in the clinic for a certain procedure that we are not able to keep our distance, the 2 meters distance, we will provide you a mask. So definitely is a must. We'll be wearing gloves and goggles, maybe face shields. So we're going to be using all the protective equipments that are required to keep the environment safe and to keep us safe and you safe. So you can definitely feel that it's a very safe place to be. We'll be, of course, continuing to wipe and disinfecting our surfaces as we did before, and being even more strict with that, right? So any place that is being touched, anytime a patient leaves the office, any surface that was touched and we were close to it will be disinfected as well. We encourage you, if you need a friend or a close family member to bring you to the office, we encourage you to just come with one person. We need to limit, of course, the amount of patients in clinic. But we do understand in some situations you might need help. So just make sure you limit to just one person. And we'll have hand sanitizer, of course, when you get into the clinic. So we'll definitely keep the environment extremely safe, so we can provide you the service that you've been looking for, maybe for those last 2 months. So we are ready to see you in the clinic for sure. So I think I went through all the safety measures, yeah. So what I want to show you now, I'm gonna go to our clinic, and I just want to say hi to someone. Hi, Fran. Oh, Fran, nice to see you. Hi, Tom. Thank you guys for being here again. I am out of my comfort zone again. I'm in a different place, so I have to be getting used to these videos every week, it seems like it. But anyways, let me take you to the room where you would be having a hearing test, and I'll talk a bit about that environment. I don't know if all of you that are watching me now have had your hearing tested, so I'm just gonna quickly run through the office, and then I'll show you some other topics that I have planned for today. Okay, so let's do that. I'm gonna be taking you with me, and I'm just gonna switch the camera here. So we're just gonna turn on the light. So this is a typical of our clinic offices. This is the sound booth where you would usually have your hearing test done. And like I said about all the safety measures, we'll be wiping all this room every time a client leaves the office, and we'll leave the door open for at least 10-15 minutes because that's necessary for the air to filter and just to keep it clean. And so that is the part. And then after the hearing test, we usually would take you in the room here, And I'm just gonna move around and I'll change you to my camera again. So let me just sit here. So after the hearing test part, we will go over all the results with you. And then if you have a hearing loss and you need to try hearing aids and you're ready for that, we will schedule you an appointment for the hearing aid fitting. During these fitting appointments, there is a very important equipment that we use. So I want to just quickly show you. This is one of them. It's a type of a real ear measurement. So when you get hearing aids, it's very important you know that we needed to verify the performance of this hearing aid. And ideally, we would need you in the office. Because of course the situation we are now, there are another option that we can verify the hearing aid. We call it as a simulated real ear measurement. So we can check and see if the hearing aids is performing based on your prescription. So if for some reason you were not able to come over, we can do that to adjust the hearing aid, and then you can just use our curbside pickup program, so you can get the hearing aids. And then as soon as you're able to come to the clinic, we still encourage you to come at least once for that test, okay? Once the test is done, that's what I want to show you today with you is about the follow-ups. So I think we are all in that stage that we want to make sure we are not being exposed ourselves, right? Much. And if you are able to have some procedures that you don't need to come to the clinic, a lot of you maybe will feel more comfortable, okay? So for that, there is something that I mentioned in one of my videos. I was talking about an app, and it calls a remote support. And this remote support, we can contact you through a video, through an app on your phone, and adjust your hearing aids live, okay? So this is one option. I'm going to show you in a moment what we see from our side here when we do that follow-up with you. In case you are not comfortable using the cell phone, or you just don't want to go over any remote support, we can also do, of course, follow-ups over the phone. So there are a lot of things sometimes in hearing aids that you just need a guide. We can send you pictures, or can send an email with instructions, and we can even explain to you things over the phone. So this is another option as well. We call it a telepractice, so we can definitely do that over the phone. And if none of those options are good for you, or if you still are, if we audiologists notice, I think he needs to come in the clinic, he definitely needs a face-to-face appointment to fix that issue, then we're going to encourage you to come to the clinic if you can, okay? So you see, we needed to adapt, right, to our new world, and we definitely have great tools to do that. Hi, Roy, nice to see you again. So let me show you. I'm just going to connect here. Let me keep you close to me. I already left the remote support ready to show you. I'm just going to connect to the hearing aids, and then I can show you exactly what happens. So start video. Okay, let me bring you here with me. So I'm gonna turn the camera. So that's what's gonna happen. So right now I'm just waiting. Actually my sister, she's helping me out today. Actually, she's helping me out every video. So I don't know if you see her, that's Claudia. So that's exactly what we're gonna see when we're doing a remote support, okay? So basically after you're ready for the remote support, we will connect you through this system here, and we can see you right there. You can see me here. Okay, and we can actually, it's a real face-to-face appointment, okay? There is a way we can show you how to put the hearing aids, because the video cameras is very good, okay? So I was even thinking another day that with the masks, this way to do follow-ups is even better, right? Because we can keep that face-to-face and helping you with the reading lips, right? So that probably will help. But once we connect you here, what we do, we are going to connect your hearing aids. I'm not going to show you that part because it's going to be too long here on this video, but we connect the hearing aids and we can adjust the hearing aid remotely and live. Okay, so it's a pretty amazing tool. Another day we already had a patient, of course we already used this tool, and this audiologist shared with us that was super nice. The patient just walked around with her, showed her garden. So you know, you maybe know that, but when we work in this field, we love connection, right? We love helping people, and that face-to-face, when we knew all of this happening, was hit us very hard. Our job really relies on that face-to-face, on that relationship a lot, right? So knowing that we can do that on the camera, at least now, it's super nice. Just make us feel a bit happier, and then of course we can still see you in the office, following all the safety protocols. So we have a lot of tools to help us through this time. And hi, hello, hey, hi Peter, and Tom. Hey Tom, you're back. That's nice. So what I'm gonna show you now, I think a lot of people have probably waiting for learning how to use your masks with hearing aids. Funny story, I was looking online and just, you know, chatting with my colleagues and finding what would be the best way for you to wear your mask and don't have any problems with them when you remove them, so the hearing aid is not lost. Okay, I found some really fun ways that use buttons on a hat, and I was just trying to I had to sew the buttons. What was tricky, I know it might be something very easy for a lot of you, but on the last couple of years, every time I need something sew or I need something fixed, I would wait my mom to come from Brazil and do that for me. So I was suddenly trying to remember how to do all of that. So it was pretty funny, but I got it and I can show you today. I'm gonna show you first, I think from all the solutions I saw out there, I have three solutions, I mean, that I feel that is the best, but it may be, you know, more creative ways will come up later, but at least for now, I think those three will be really helpful. One of them, so I'm gonna just get my one of masks here. Oh, this is broken. Okay, I have a mask here. So one of them is, you might have seen, there is quite a bit of different adapters. That was pretty popular, was on the TV a lot, that was helping a lot of the nurses, right? And all the health professionals that have to wear a mask constantly. So this adapter here, I'm gonna show you, they look like that. So what do you do? And you know what I wanna show you? I forgot to get that. Do you have can you get a phone paper clip? I'm gonna show you another way as well, because I saw that online and that must be a good way too. So what you can do here, you will put this type of adapter on one side of the mask. And when I put the mask, I don't know how well you're gonna be hearing me, but basically what I'm gonna do is I'm gonna put it around my mouth, and this adapter is going to be sitting right on the back of my head. So the big problem, of course, we know is with the elastic. It sits like here. So it bothers you quite a bit because it creates a pressure. And then when you remove it, the hearing aid can fall off, right? So if you can find a way so that elastic doesn't go around the ear, that's the most comfortable way, okay? So different ways. So this is the adapter, and we can help you to get one of those. We know where to find them. So like this. And I'm not gonna put it perfectly, but you can see. Let me just show you. Okay. You could potentially keep it here as well, but it's not gonna really go around the ear, okay? So I'm gonna just put that again for you. Okay, could you see it? Oops. Could you see that well? I hope you were able to see it. Thank you, Eva. Thank you. You enjoyed my presentation. So this is one way. Another way that I saw that is good as well, instead of using this type of oh, I find out how to get the adapter. Yes, Janice, we can definitely help you to find this, okay? Another way is you can use a paper clip as well. So you can just tie it up, the elastic on the phone clip, on the paper clip, I mean, and that's gonna be the same idea, okay? So it kind of hooks this way, so then your elastic is right on the back, okay? And it's not really holding around the ear. So that's one way, and that's specifically, let's say, if you don't wear glasses. If you wear glasses, I have I think, I don't know, I try it and I really like this idea. And I did that on my glasses. I'm gonna show you. So look what I put it on my glasses. I have a button on it. Okay, I didn't have the same color, so it doesn't matter, but you can see it. So how it works, you will get a button, and I'm gonna show you how it looks like with the mask, because it's amazing and very comfortable with the glasses and hearing aids. You know this type of elastic? This is like a little, usually I think more for kids when you do, you braid the hair. It's very durable, like but very thin and small, okay? So what you're gonna do, I'm gonna show you in a moment here. You will get that elastic, and then you're gonna go over, like just put it in one hole, and the other side in the other hole. I'm gonna show you with mine, but just so you can see the parts. So when you do that, the other side, it's here. You see the elastic on there? It holds really, really well, okay? And the good thing that I felt was, oh, I look good in glasses. The good thing is, it doesn't bother you at all. Like you don't even feel the button in there. So then when you put this, your mask, sorry, not this, your mask, you hold on the glasses here. Okay? It's just perfect. It's so easy and so comfortable, because then the elastic of the mask, it does not sit around the ear at all. It doesn't even touch your hearing aids. So I feel that if you wear glasses, at least for now, I think that's the best way I saw it, okay? I do feel you can leave the button there all the time, and yeah, it's pretty amazing, okay? So I can even take it off one of them here. I think you got the idea, but I'll remove it one of them, so hopefully I don't lose the elastic, but I just want to show you. And it really stays well, like it doesn't, you won't lose this mask and you won't lose the glasses and the hearing aids. But let's see, there we go. I can show you. See the elastic in here, and then the other side are here, okay? And then you just get the arm of the glasses and put it through the elastic. So I don't know, I try it. I kept that over the weekend, and I felt very comfortable, was comfortable with the mask, and wasn't, you know, I wouldn't feel the elastic behind my ear. So I think it's the best way now with glasses, okay? Another really good way that I found, again with the button, I like the idea of the button, really worked well when I tried, is summertime is coming, and you maybe can be wearing hats, right? So what I did, that was my part when I tried to sew the button, but I guess I did it right. The button right here. So basically what you wanna do, you wanna put the hat on, and you wanna put the button kind of in the same direction as your ear, like, okay, so that's my ear, that's my button right here. So the button is right there. So what you do, same idea as the button on the glasses. This is going to hook on the button here, and Okay. Could you see that? Yes, exactly. Perfect for, exactly. So I think Janice, she's saying that's gonna be perfect for her, the baseball cap. I think that's a great idea. Both of them, this is wonderful as well, like it's just more on the back. But the buttons, I think it's definitely a really good solution, okay? Because the elastic doesn't go over the ears at all. And super comfortable and super safe with your hearing aids. So that's the three options. I just looking through the options, that the ideas out there. I wasn't creative enough to create my own idea, but those ideas that I found, I think they're gonna be really helpful. Okay. Hey Sima, I know the button idea, it's great. Okay, easy. Okay, easy peasy. So I think that's all I had for today. If you, I know we have maybe some questions there. I'm gonna wait, my sister, she's gonna tell me if there's any question that I wanna, that we can go over so the video is not too long. Let me see, Chris, tightness is not an issue for Corona. Yes, I know, Chris. What three options? I showed you, this was one of them. It's just adapters that you put on the back with the elastic, and then the option of the button on the glasses and the button option on the hat. Okay, so those are the options. And then of course I also show the paper clip as well, that you can do the same thing. I didn't show you because of the paper clip. Let me show you while she's checking out all the questions there. So yeah, I think that the paper clip, of course, is just a more simple idea there, but you see that? Okay. If I try to put on me now, my elastic is gonna break because you actually need to clip when you have the mask on. But basically you put it on, yeah, it's gonna break, but basically you put it on and then you would clip here. Could you see it? Good. Okay. All right. Good. I'm glad, Angela, that's a good idea. Okay, so let's see what are the questions I have here. It might be not related to our topic today, okay? I'm just gonna see if I can help any else through this video. So Christiane, if you have time, you can also add how we can wear a mask when we have a hearing aid in one ear and the processor in the other. Great to have the opportunity to hear and see you. Oh, hey, Fran. So I think, Fran, those ideas I showed you probably are the best ideas, okay? When if you wear hearing aids or cochlear implants, she does wear a cochlear implant, so it would be the same idea. I think the button idea is definitely good. The hat might be a little complicated if you have a processor, but the glasses, definitely a great idea, okay? When you make an appointment for hearing aids to be retubed, do you drop it off and pick up the same day? That's Janice. Most likely, Janice, unless the clinic is extremely busy with, you know, other type of cleanings that they have to do, but most likely they will be able to do that the same day. It doesn't take too long, so you can probably drop it off and pick up, and they're gonna let you know the best time to do that. Okay, so Tom have asked me if he has a moderate to severe hearing loss, and if we make molds. Yeah, we make anything, you know, that you need for hearing aids. So ear molds is definitely one of them. I think that's a good question, Tom. Of course, to make an ear mold, we won't be able to keep the 2 meters distance from you. So definitely safety protocols, measures, really strict for that. Wearing gloves, mask, goggles, everything that we need, and you need to be wearing mask for sure for that procedure, okay? So Marvin in Maple Ridge is wanting his replacement hearing aid. Can I get them both calibrated together? Yes. So Mervin, when you need the hearing aids, if you order a replacement, we can do that simulated, we call simulated rear measurement. So it's a way to verify the hearing aids if you're not able to come to the office for that. If you're able to come to the office, I would probably encourage you to do so, as we can do an even more precise fine tune on the hearing aid. But that's something that can wait, as we can do a verification without you here as well. So, and then when you feel ready and healthy and safe enough to come over, then we can do the test in person, okay? So that's good. Hey, Rick. Okay, so missed where we get the buttons. No, the buttons is just an ordinary button, Elaine. It's just a button that you can just get anywhere, okay? So no, nothing specific about the button. Of course, I wouldn't get a big button, so something is smaller. You see how it looks like here. And even on the hat, I use quite a tiny button. This, I think, was maybe a little too tiny, okay? But it did hold well, so that could be an option as well, okay? So, okay, so that's good. I think we're good. Thank you again for being here. Just, you know, if you're ready to book an appointment, give us a call. Call your local clinic. Again, Ontario is going to be opening for patients in 2 weeks' time, and then Nova Scotia in 1 week time. But the rest of the country, we are open and ready to help you, and definitely keeping the environment safe for you to come over. And what else? I think that's it. So stay safe, stay connected, and as I said in the beginning of the video, we stand against any racism, any type of discrimination, and let's spread love. Let's make our world better, okay? Big hug to all of you, and hope to see you again next week. Bye.